Something is really grinding my gears right now, and that is one, thinking that your vagina is in more pristine condition if you have a C-section, a more pristine condition for certain activities with certain people, as well as people also think like, oh, if I have a C-section, I won't have any bleeding. Now, first of all, regarding the bleeding, like, yes, you are still going to have bleeding after a cesarean delivery. It might not be as much as the average vaginal delivery, just because if you have a vaginal delivery, there can be like sometimes vaginal tissue damage, or maybe you tore, so there can be a little more bleeding due to stuff like that. But the majority of bleeding that you have after birth, whether you have a vaginal or a cesarean delivery, is from where the placenta separates from the uterine wall. So you're still going to most likely bleed for a decent amount of time, up to 6 weeks potentially, and still potentially have blood clots. Now, regarding your pelvic area, you can have pelvic floor issues with both types of births. Your vagina is a circular muscular organ with smooth muscle tissue, and it can be strengthened through pelvic floor exercises and with pelvic floor physical therapy, which is amazing and can do wonders for a lot of people. I also like to point out, if you don't know this, that muscle can contract very much when we are meeting the needs of our female partners. So let's have some conversations about that with our partner. Let's make sure that they're feeling safe, comfortable, and loved, not just during that encounter, but all the time, so that we can both have a mutually beneficial experience. But yes, stop thinking that because someone had a C-section, that those things are true, because that's not true.